Hello and welcome to Dragon Bytes, the paediatric podcast aimed at paediatric trainees or anyone interested in child health. I'm Asim, one of the paediatric trainees here in Wales and one of the presenters for Dragon Bytes. This week we've got another one of our Grid career podcasts for you. Alice Knight, one of the new presenters at Dragon Bytes, is joined by Endocrine Grid trainee Georgina Williams to discuss how to apply for and interview for the Endocrine Grid post. So, let's get started.
Hi there, my name's Alice and I'm the Dragon Bytes host for today. And we have got the lovely Georgina with us. So do you want to just introduce yourself, Georgina, and let us know a little bit about yourself?
Hi, I'm Georgina. I'm a grid trainee in pediatric endocrinology and diabetes at Bristol and Cardiff. So I've just finished my year in Cardiff working with you, Alice, as well.
Yeah.
And now I'm back in Bristol, which is where I started.
Oh, and we miss you over in Wales.
Oh,
Um,
thank you very much.
you had the joy of coming over to us for the COVID season, so a bit of a funny time. Um, can you just tell us a little bit about your sort of medical career to date?
Yeah, of course. So I took a fairly long and winding route, but I can hopefully condense it a bit for you. So after doing my A levels, I didn't get the A level grades to go and do medicine and went through clearing and ended up doing medical biochemistry at Birmingham. And I completed my degree there and then went on to do medicine after that at UCL. In fact, it was Royal Free and University College Medical School at the time. And then after I was there, I went and did my foundation years in London and then applied to do pediatrics. I stayed in London until ST4, when I then moved to Severn Deanery. I did part of my ST4 in Severn, and then carried on until ST6. During my ST6 year, that's when I really got lots of experience in doing diabetes and endocrinology at Bristol. I managed to have a whole year doing it, which was excellent. And following on from that, I went and did a PhD with Professor Hamilton Shield, who is one of the professors in endocrinology and diabetes at Bristol. And then after that, I spent 4 years doing my PhD because I also had my children during that time. And then I came back and have completed my grid. So I'm now doing I've done my ST7 year and I'm doing my ST8 year.
Wow, that's quite a journey that you've been on. Sort of going sort of back all the way to London, then to Severn, and then over to Wales, and doing a PhD and raising a family during that time. It's quite incredible.
Yeah, so I did a little tour of universities as well along the way. So that was always fun as too.
And what made you sort of going back a few steps? What made you choose pediatrics in the first place?
So I knew from quite an early age that I wanted to do medicine, was very interested both in the science of biology and humans, but also in caring for people as well. And then I was very lucky when I was 16, I got to go over to Canada and actually do some work experience with a pediatrician over there. And really, I absolutely loved it and decided that this was definitely going to be the career for me. I loved the interaction with the children mixed with the science and the detective work that goes on in pediatrics. Yeah, so having lots of fun with kids whilst also learning lots about science.
Absolutely. Well, it is obviously the most fun speciality. We know
Yeah, definitely.
that. You've explained sort of why pediatrics, and then what sort of drew you into endocrine?
So I had a number of opportunities of getting experience in endocrinology. I did it in my, I think it was ST2 year. It was a long time ago, so I'm trying to remember exactly which year. So when I did my ST2, I did adolescent medicine and endocrinology at UCL. So got some experience of it then, and really learnt at that point, that it was a really holistic subject, particularly diabetes, where you get to see children for over a long period of time and really get to know their families and understand the dynamics and some of the barriers to them continuing to look after their diabetes, and how you can really work with them and help them to understand their condition, but also help to motivate them in their life in general, as well as with their diabetes care. So that was fascinating. And then from the endocrine side, it's really a subject that's changing all the time. There's lots of evidence-based medicine, so lots of research going on, which is really interesting. There's lots of opportunities to um, collaborate and to work with people from all around the world. I've been very lucky going to some fellow schools with ESPE, which is the European Society of Pediatric Endocrinology. Doing these things really made me realise that it's such a varied and interesting subject with lots of opportunities.
That sounds very inspirational. I'm like, like, ooh, maybe endocrine.
Well, I think the other thing about endocrine is some of what we do is helping people to understand, because we're looking at growth and puberty. Some of what we're doing is actually reassuring families and telling them about what's normal, and the normal variations that go on in human beings, which is also really fascinating, and is lovely to be able to do that for people who obviously may have anxieties that once we're able to explain things to them can melt away.
So I'm just kind of like mesmerized by all of the different aspects of this now. I'm like, I was just
Oh.
so you've sort of done quite a lot of your training now and coming towards the end of your training, and you've also managed to do accomplished a PhD during that time as well. How long have you got until you sort of complete until you CCT and become a consultant?
So I'm working less than full time. So I have a year left, my ST8 year,
Mhm.
but will take me to July 21, which is when I should CCT at that point.
Whoop, whoop.
So not so long to go.
Not after the journey that you've been on to get here.
No,
So,
it's been a while. So yes, yeah.
and what would you say? I think we've kind of like covered some aspects, and it's really clear that you're really passionate about endocrine and diabetes. But what would you say is the most rewarding part of your job?
I think it is one of the lovely things about endocrine is the fact it's quite clinic based, and we do spend quite a lot of time getting to know the families. We have to see them. They may be on long-term medication, particularly with diabetes, obviously, but in other conditions as well, where we do need to monitor them at regular points. So our children who are on growth hormone, for example, or our children who we are taking through puberty, and we really get to go on that journey with them to see how the treatment that we're giving them can change for them, but also to see them grow and develop, and that's really lovely, and I think is one of the most rewarding parts of our job, and to see how that changes the parents as well when they first come to us and their anxieties, and how we can then help to really make a difference to their lives and hopefully to their futures as well.
Amazing. More about the sort of training itself. What does training, sort of subspecializing in endocrine and diabetes, what does that actually look like? What does it involve?
So for grid training, it's either a 2 or 3 year course, so 2 year minimum. And it's important to know that when you're thinking of applying, because you need to ensure that you've got enough time left for your training. So it's 2 or 3 years. In my case, it's based over Bristol and Cardiff, so that you have in my case, I had a year in Cardiff, and I'll have just over 2 years in Bristol, just because I'm less than full time. And it really involves most of your daytime is doing endocrine and diabetes, and and that's split so that you get opportunities to attend clinics in both. And very much, it's, as I said, it's a specialty where it's quite clinic based. So during your training, you will spend a lot of time in clinic. We do also have some inpatients, both for diabetes, obviously the new diagnosis patients, but also those with DKA. And then we also would be covering the on-call rotas as well, doing other specialties. So getting your experience in general and things based on doing your on-calls.
Which is where we got to know each other.
Exactly.
Many night shifts hanging out together.
Indeed. Yes, yeah.
Are there any sort of specific posts that you have to do within those 2 or 3 years?
So within those 2 or 3 years, you obviously do need to make sure that you get enough experience in both diabetes and endocrine.
Yeah.
So you're expected to complete the same as somebody who would be doing a spin in diabetes. So make sure that you achieve the same competencies and that you attend the same requirements within the spin diabetes curriculum. And then for endocrinology, again, as I say, it's making sure that you're attending enough clinics, but also attending some of the specialist clinics. So making sure that you get to see some of the things such as the metabolic bone disease clinics, the late effects clinics for children who've gone through treatment for oncology. So those are important clinics to be attending as well during your training, and you're expected to have covered those during your time.
I think that sort of leads quite nicely actually onto the next question, which was, are there any sort of specific requirements that you need to have achieved by the end of your training? Is it mostly sort of competencies based and making sure you're going to clinics and doing those sort of specialist kind of tests and showing that you can do those, or is there anything extra?
So I think endocrinology, as I say, it's very much there's a lot going on in terms of research, and it's very much being able to have an understanding of that as well. It used to be that it was expected that people would have a PhD possibly even before applying for grid training, but now it's certainly expected that during your grid time you do get some experience in research and have a period of time in research, and that is very actively encouraged and is something that you should do during your training time. Whether that's a PhD or whether it's just having a specific block where you have time to do some research.
So it seems like there's quite a lot of different opportunities to sort of get involved in like an area that you're interested in with the kind of research side of it.
Yeah, and absolutely, as I think everybody who chooses pediatrics discovers, it's not once you've chosen pediatrics that you then find yourself having to make further and further choices. So yeah, once you've decided that you're doing pediatric endocrinology and diabetes, then there are again opportunities to specialize within that as well.
So just literally about to sort of say it seems quite a specialised area, and you were really fortunate. It seems from your kind of story and your journey kind of to this point, that you were fortunate to get posts when you were an ST2, and then further experience like a whole year of diabetes and endocrine. What would you sort of recommend or suggest to trainees who have got an interest in endocrine and diabetes and are wondering whether or not, this might be either a grid specialty or a spin interest that they might want to do? How would they get experience from that?
I mean, obviously, with anybody who's got a particular interest, flagging it early to your training program director and letting people know early on, so that if there are opportunities to have placements within that specialty, then that obviously gives you the best exposure. But that's not always possible, and I think that is understood when people are going for grid training applications. So it is trying to make sure that you get some time to at least sit in some clinics and understand what's involved. Do speak, we're a friendly bunch in endocrinology and diabetes, and do come and speak to, the consultants or the trainees to see if you can get some experience. Obviously, it's a bit difficult in the time of COVID as far as sitting in clinics, but it may even be possible to help sort of sit in with attend anywheres or virtual clinics and just get some idea of what's going on. Ideally, if you are going to be applying, you do need to show that you've had an interest, and if you are able to get involved in any projects, any audits. Obviously, there is overlap with general in several areas, and even if you're able to do a project within general pediatrics, but which has an endocrine or diabetes slant, then obviously that would be very helpful for your grid application. And also things like QI projects as well. There is obviously a lot of time with our diabetes patients where they may be managed by general pediatricians too. So it's getting those opportunities and trying to think around how you might be able to help yourself to get some exposure, as well as talking to people about getting some time in clinic.
Wow. So have you got any sort of specific advice for that you would sort of suggest for trainees who are wanting to apply for diabetes and endocrine? I know we've kind of touched on it a little bit with sort of getting involved in projects and things. Any other sort of top tips?
Yeah, so there are also the British Society of Pediatric Endocrinology and Diabetes. They have a conference each year, which also has a medical education day on the first day. Obviously, if you're able to attend that or go to the CME day, that the continuing medical education day at the start of the conference, that obviously would be really helpful and very interesting, and would obviously give you a nice broad view of endocrinology as well. There is also a retreat for trainees in endocrinology that happens every year. It is mainly open to grid people who have a grid placement, but they do also have some slots left over sometimes, which other people can apply for and try to get into as well. And obviously, if you were able to do that again, that would be excellent and would give you a good experience, but would also give you the opportunity to talk to current grid trainees to get a good understanding before you apply.
Very good networking opportunity there.
Yeah.
It sounds very luxurious. A retreat for endocrine and diabetes. Is it
Yeah,
like spa
it's actually a virtual day on Saturday, this coming Saturday, so that might be
involved?
less retreatish, but maybe I'll make myself a nice coffee.
Probably no face masks or sort of spa treatments or anything else going on. Just
Oh, you made me think now. I might have to buy a face mask.
I think that would be a great look when you could pop up on the video chat. So, moving on to sort of chatting about the interview, because I think people who are sort of listening to this podcast, they're applying, they've got, they know they're passionate about endocrine and diabetes, and they want to know what's the sort of, what do they need to do to get the interview? What's the sort of top tips for getting that sort of highly sought after interview in the first place?
So I would say absolutely give yourself time and read what's on the website. So it really helps you and guides you through. On the Royal College website, when you go onto the grid applications, grid specification details, on there it actually tells you exactly sort of how they long list and how they short list, and gives you even the sort of scoring system on there. And I think it's really important when you do your application to work through that, and try and make sure you put something in every box and that you're able to score as highly as you can based on those person specification. Um, and it's important to know that actually that counts as 25% of your score that goes forward when you go into your interview. So it's really good to get that as best as you can. As far as the interview is going to ask you about those things that you put on your form. So if you're putting them on your form, make sure you know what you've written and make sure you know what it is and how you can evidence it and how you can talk about those things as well. So that's really, really important. And they also talk about sort of essential and desirable. Obviously, if you can tick both, brilliant. So if you can make sure you've got something there, that's really good. What they want to know in the interview is that you know what you're applying for. So they want to know that you have spoken to people who are in the area, that you know what the final job would look like, so what it would actually be to be a tertiary pediatric endocrinologist and diabetologist, that you know about how you would work within a region, and how you would be working in a network with shared care as well, and all of those things. They want to know that you understand that sort of final job is important. And then they really want to know that you're passionate about it. They want to know what you've done, how you've gained some experience, how you've potentially already done some work to further sort of endocrinology and diabetes, and what you, if you haven't done that, at least be able to talk about what you might like to do or what you think you could possibly do. So that's important to think about as well.
And is there sort of scope on the application for talking about other things, maybe like teaching, leadership, research that's maybe not diabetes endocrine specific, but might sort of have other aspects that they might be looking for?
Absolutely. So when you look at those, when you look at that scoring system, quite a lot of it is around generic skills. So exactly what you're talking about. Have you done QI projects? Have you done audit? Have you done teaching? And on what level has your teaching been? So yes, absolutely, those are generic skills that aren't specific to endocrinology and diabetes. I can't say it now, Alice. You've got me thinking about it. Um,
When you say it too many
um,
times in a row. That's the challenge
um,
at the end of the podcast. How many times can you say it
yeah,
in a
can you
row?
say endocrinology? Yeah. Yeah, so absolutely, yes, those generic skills are looked for, and they want to know that you've got some experience in sort of management and leadership things. So yes, anything you can draw in from things you've done in the past is excellent.
Well, that's fab. I think often we, as trainees, we sort of downplay what we have to do anyway as part of sort of Kaizen and portfolio. But I think you can sort of lots of things can count, and we don't often recognise that these are things that we're doing anyway as part of our training.
Yes, yeah. And also they also want to know things like, have you been doing reading around the subject? Is there any paper that's interested you? Is there something that you've seen that has sparked your interest in this subject, in this area? So yes, absolutely. Those sort of things as well that you can do in your own time. You don't need to be sat in a specific clinic to be able to learn about endocrinology and diabetes.
Absolutely. We've always got to do the journal club presentation, so maybe choose an endocrine diabetes one or something like that, just
Yeah,
to show
absolutely.
interest. So we've touched on the interview a little bit already, but sort of focusing a little bit more on that. What would be your sort of top tips for how a trainee should get ready for the interview?
So I'm sure we all have our own ways to sort of prepare and keep ourselves calm and relaxed. But absolutely, it is a chat. It is an opportunity to sell yourself and talk about all those things that you've done in the past. And as you say, we sometimes think we haven't done that much, but actually, when you start looking at all the different projects and things you've been involved in, you will have done lots. And do, just make little notes to yourself, keep a little checklist. You don't want to be sounding too rehearsed or sounding like you've done, too much preparing in that way, but just make sure you know what's on your application form. Have a little read through that before you go in. Make sure, if you've got some little notes, reminders of things you thought, oh, actually, I didn't put that in my application form, but this was something really excellent I did. Make sure you've got those things so you can remember them when you go in. And I would say, obviously, I imagine at the moment that all the interviews are going to be virtual. Um, Another good thing to do is actually have a little practice of getting everything set up, making sure you know what you're doing, work out where you're going to be in your house, make sure, like with doing this podcast, we have all the right equipment, um, so that you can feel totally relaxed about those things and they're not also playing on your mind when you're about to go in. But everybody, when I went for my grid interview, everybody was really friendly and really lovely, and they did really, they've already shortlisted you, they've already looked through that application form and think you're good enough. They want to make sure that you are that person, and they want to just get that little bit more from you. So it's a friendly and good opportunity to say what you're interested in and talk about your passion.
Absolutely. So with this in mind, are there any sort of good resources if people are sort of thinking maybe they're listening to this and they're thinking they're going to apply for Grid in a few years' time, or they're about to do the interview soon? Are there any good resources that you've got that you think actually that would be a really helpful thing to have a little look through?
So I do think look at some papers beforehand, look and see uh, what's recent, talk to current trainees because they may be able to advise you as well about interviews. You might be able to have a little practice with one of them. Do talk to people and talk to your local trainees. We talk to me if you want, whoever is around, and we'd be very happy to help you and talk through how you might prepare and the sort of questions that might come up.
Or any, are you allowed to give us any ideas about what sorts of questions come up?
Well, I think it is around the things I was saying about making sure you know what the final job looks like, making sure you know what you've put on your form. They really want to check that it was you that did that. There are some cases, but nothing that would be surprising. Just do have a little read about endocrinology. Make sure there is a little Oxford handbook that's quite helpful. You can sort of have a look through some of the conditions and make sure you've got those in your head. It would also be important to know, there's recently a new DKA guideline, things like that, making sure that you have all of those things that you've at least looked at so that you might be able to have a discussion around those if they came up.
Okay, and when candidates are answering questions as well, any sort of top tips on how to structure their answers to make them sound better or to be able to sell themselves more? Any top tips?
Yeah, so I think it's quite easy to sort of, and I'm probably doing it now. It's quite easy to rattle on. I think I always think it's quite good to tell them what you're going to tell them. So, yeah, so I would try and structure it so that I would say, I'm going to tell you about my past experience, what I've done, and what I'd like to do. And, I'd make sure, however you're going to put it, that you sort of tell them how you're going to do it. So give yourself a little sort of run in before you start, because actually it gets your brain thinking like that as well.
Yeah, so it kind of structures your kind of structuring your answer and signposting to what you're going to talk about in a way.
Exactly. And then it makes it easier for them, particularly if you've looked at how the scoring system works on the person specification. You know that you can almost imagine they've got their tick boxes in front of them, and what they really want to hear is those key words. So making sure that you get those in and that they're able to tick them off.
Oh, great top tips there. Um, so last, just as we're sort of tying things up now, how long does the interview actually last for?
Oh, I can't remember. That's terrible, isn't it? It feels pretty fast. I seem to remember it. I seem to remember it felt quite fast. Um, uh, Possibly because I was talking too much. But yes, it doesn't. There weren't lots of long pauses. They keep it moving through it, so it didn't feel like it went on forever. It felt quite quick.
Yeah, so just wanted to say a massive thank you to Georgina for coming, having a chat, and giving us all her top tips about endocrinology and diabetes. I'm very proud of myself that I just managed to say that once again.
Oh,
But yeah,
it was my pleasure, and it was lovely to chat to you, Alice. I really would like you to say thank you to me in Welsh now, though, because I have missed it.
diolch yn fawr, Georgina. Thank you very much.
Thank you.
And well to you.
And I just wanted to say thank you to Alice and Georgina for an excellent set of tips there for us. Good luck to anyone applying for endocrine, and we'll see you next week on Dragon Bytes.
Endocrinology, endocrinology, endocrinology. Woo! I did it.
Excellent.
And on that note,
Yeah, and you can cut out a few endocrinologies in that podcast.